we published a white paper that was written for health policymakers, not for MDs necessarily, but really for health policymakers, that is titled "Building Thrombectomy Systems of Care in your region, Why and How." And this, we think, is really needed because a lot of times the research and the medical knowledge takes a long time to reach health policymakers, and this white paper simplifies it and lays it out as to what is the need for thrombectomy systems, why it makes sense, the cost effectiveness of it, and then how to actually implement it is all outlined in the white paper.
This is the Public Health Insight Podcast. Before we move on, it is important to note that the views expressed in this podcast are our own and do not represent any of the organizations we work for or are affiliated with.
Dr. Dilip Yavagal is a leading interventional stroke neurologist and the chair of an initiative led by the Society of Vascular and Interventional Neurology called Mission Thrombectomy. This initiative is guided by a systems thinking approach to address the global burden of stroke at all levels of prevention. Ben, Gordon, and LaShawn continue their conversation with Dr. Yavagal to dig deeper into the ambitious initiative and how it can reduce the morbidity and mortality associated with strokes. This is where they left off.
And that's a great segue into our next topic, which is MT2020+. And if you could just please speak about the goals of it, and we'll have some follow-up questions regarding the more logistics of it.
Mission Thrombectomy 2020 Plus was conceived and developed in late 2015 and launched in 2016 by the Society of Vascular and Interventional Neurology. I had the privilege of founding this campaign and developing it along with a team of world experts in thrombectomy and stroke from the SVIN. And the leadership committee from SVIN felt that while there were so many societies and stakeholders who were bringing thrombectomy at the new standard of care to patients, especially in the US, that there was a real need to make a global push for bringing this therapy to stroke patients. And so by that, we mean accelerating access, because the burden of stroke as the leading cause of disability is really distributed throughout the globe. And actually the major burden, about 80% of the burden, is in the low and middle income countries. And the resources, as we all know, to counter this huge burden that's both at a personal level of long years of suffering and sometimes death, the economic burden, and the overall ill effects on the society are really distributed in a big way in the low and middle income countries. And hence the goal of Mission Thrombectomy 2020 is to accelerate access globally via public health interventions, and I'll elaborate what that means for us, so that we could bring this overwhelming benefit of mechanical thrombectomy for stroke patients throughout the globe and make a true dent in the stroke disability in the world. We felt that if we focus just on the high-income countries and only on the US, the dent would be so small that it's not as meaningful as a global approach and increasing global access. Now, having said that, the scope was clearly, obviously very big, but we felt that a network approach of two-way sharing of best practices to develop public health interventions customized to each region could work very well in accelerating access. And that acceleration would be relative to that region. And so we felt that we could implement common principles and common strategies customized to that region and accelerate access. I also want to mention that we collaborated with experts in treatment access at the University of Miami, where we learned that there's a very large body of science behind how new treatments diffuse into the community. And it's actually well worked out that it takes sometimes 30, 40 years for new treatments to be accessible to even 50% of the population. And so one can actually shift this curve to the left, and our goal is to cut this in half or even less, this time taken for new treatment, the new treatment of thrombectomy, by implementing public health interventions. What do I mean by public health interventions? So while there are routine efforts of setting up stroke centers in different hospitals and identifying patients with stroke and bringing them to the right hospital, a policy level approach can accelerate this process in a big way. A state and national policy recognizing thrombectomy as a highly effective therapy that can make a dent in public health would then allow for stroke networks to be formed in a geographically optimized manner, where every patient would have the chance of a quick access to a stroke therapy, where reimbursements for thrombectomy treatment could be again optimized so that lack of reimbursement doesn't hinder access, and then a pre-hospital system that truly is able to triage the right patient by recognizing them in the field and bringing them to the right thrombectomy center that's closest would be a approach that could accelerate this process of accessing thrombectomy. So that's in a nutshell the overall philosophy and the mission behind MT2020 Plus.
Awesome. I think you touched on some major points. Often the gap between research to practice, I think you alluded to, can be too long in terms of number of years. And a lot of times if medical technology is constantly evolving. So if things don't get implemented shortly after discovery, it, can increase the risk of being obsolete. So knowledge translation practices and moving stuff from research to practice, like you alluded to, and being actively involved in that process is something like, a lot of people in the healthcare field, like yourself, are seeing the value of, and, creating that dialogue needed to get, policymakers aware of these, cost-effective interventions, and also stating kind of that business case for why it's important to implement in those health systems. So thank you for that.
Absolutely. And I didn't really bring up the cost effectiveness a part of thrombectomy earlier, but it is another bedrock of why we are taking this approach, because at a personal, societal, and a governmental or a national level, thrombectomy is very cost effective as per a large number of peer-reviewed data that have been published. And this is the case even in low and middle income countries. This is now published just recently from a trial in Brazil called the Resilient trial, where not only was thrombectomy way more effective than conventional therapy for large vessel occlusion stroke patients, but it was also cost effective. And the overall reason for this cost effectiveness is that multiple years of suffering of disability lead to a huge cost that are way more than the upfront cost of the procedure. And so this cost effectiveness really behooves us as communities and societies to bring this treatment to as many patients as can benefit, and do that rapidly, so that the benefits can be accessed, and a lot of personal, social, and economic burden can be prevented.
Yeah. You mentioned that, you started the development of MT2020, and released it and launched it in 2016. I was wondering if you were able to share any sort of, lessons learned, or maybe preliminary results or success stories that you found so far. And I know that the plan is to extend this and, go past 2020.
Absolutely. So the biggest challenge we faced was getting the funding to implement such a ambitious and project that was so big in scope. And in fact, one of the initial estimates we got from an administrative standpoint was in the millions, which is not something that a smaller society like SVIN could pull off, at least right away. So we started small and really spent the initial first year in refining the concept and refining the operationalization plan and as to how we would do it. And we came up with the plan of forming regional committees that would be structured in a horizontal manner, so that the core US committee was at the same level as the regional committees around the globe, and we would have a two-way communication to implement the goals of MT2020. So it was really a learning process for all of us, because we are mainly stroke and interventional proceduralists and not necessarily public health experts, but also as the experts who brought this therapy to standard of care, we were in a position, we are in a position to be its strongest advocates at a public health level. So it made sense to learn these principles and put the structure in place. And then in 2017, with some more funding, we implemented a survey in the US itself that was released in 2018, where we showed that the barriers to access in the US were clearly significantly higher for the rural population to access thrombectomy. And then in 2019, we got a structure in place globally with the help of a third-party project management company, Orbis, that really also has the passion for stroke care globally. And that has finally in 2020 allowed us to launch now 82 regional committees around the globe that are comprised of stroke and interventional experts in several countries around the globe and in 6 continents. And these regional committees are fully committed and vested to implementing the goals of MT2020 plus, with a approach of public health intervention. So the lessons are that even though the public health approach, and especially a global public health approach, can be very daunting, it can actually be pursued even with mainly the help of volunteers. But also it was clear that you need professional help for sure to organize. The thing that has helped us a lot is technology. WhatsApp communication. Without that, we would not be able to connect globally so easily. And certainly we are using some project management tools to have a low administrative burden to implement this. So that's really been a very thrilling ride, so to speak. And we just changed the name from MT2020 to 2020 plus, because we want to keep going, as you alluded to, and really bring the real interventions that need to be implemented to the fore. In fact, all regional committees are actively developing top 5 interventions for their region for 2021 as we speak. And so those will be publicly shared and committed to and implemented. And I do want to mention one big milestone. We published a white paper that was written for health policymakers, not for MDs necessarily, but really for health policymakers, that is titled "Building Thrombectomy Systems of Care in your region, Why and How." And this, we think, is really needed because a lot of times the research and the medical knowledge takes a long time to reach health policymakers, and this white paper simplifies it and lays it out as to what is the need for thrombectomy systems, why it makes sense, the cost effectiveness of it, and then how to actually implement it is all outlined in the white paper. So one of the big tasks each regional committee is taking on is to connect with their health policymakers. Of course, in the middle of a pandemic, where they're they have their focus on the pandemic, but still the efforts are very much in place to connect with them with the white paper, so that the thrombectomy systems building and strengthening can occur quickly.
Definitely. I particularly appreciate the piece about the regional committees, because each region has their own unique context and challenges that they have to cope with, and whether it's resources or community buy-in, or what you have things like community of practice. So I really appreciate that it's not more like a one-size-fits-all approach, but it's just here's some of those key elements that you can tailor to based on what the situation looks like in your region. So very much appreciate that kind of foresight on that as well.
Thank you.
If different regions don't have the resources to get patients to the associate centers, like how does that look? And I think the paper touched upon one point where it's like sometimes the ambulatory vehicles or the helicopters that are transporting patients must be prepared to carry out the thrombectomy. And I was really glad that was pointed out in the paper, and it goes back to Gordon's point, like it's very region specific. One of my main gripes that I have is that whenever there's a document released by a major organization, it's like, here's a solution and you got to figure it out how to make it applicable or contextually relevant. Mm-hmm. So great job on the white paper. Can't say more than enough.
So again, the approach that MT2020 has taken is something new for SVIN. We've been in existence now for 14 years, and most of that time until 2016 has been doing conventional things that medical societies do with annual meetings and publishing, scientific papers and guidelines. But when we took on the public health initiative of MT2020 Plus, we also taught ourselves that there isn't much point launching something like this without a metric to measure ourselves and the campaign's impact. Mm-hmm. And we came up with something that is fairly simplistic, but we felt, thinking about it again and again, that it would make good sense to have as a measurable metric, which would be to double the rates of thrombectomy in every region every 2 years. Mm. And it's sometimes catchy things can be not that real, but we do think that it makes a lot of sense to pursue this at least for a few years, because of both the fact that every region is so variable in their rates of thrombectomy, but even the leader in thrombectomy, which is the US, has hundreds of thousands of patients who do not get thrombectomy even as of 2020. So there is a huge gap in the US, and then that gap is many-fold in the rest of the world. So if we went with doubling as a goal, at least for the first few years, we would have a true steep rise, which is really the goal of thrombectomy. Now, having said that, clearly we don't have answers for every 2 years, but we have therefore made it a annual planning approach, where every year the regional committees can recalibrate and decide what at this point in time for this year would make the most impact. And the doubling is a very a tall order, a very tall goal, but we do feel like it then prioritizes so many public health interventions that can be done, and so that's how that's the metric, and that's how we came up with it. And we do feel very happy that between 2018 and 2020, it looks like we will meet our metric. The number of thrombectomies globally around in 2018 were right at about 100,000. And the projected thrombectomy rates for 2020, which was set as a metric of 202,000 by the campaign, are going to actually exceed that number. And so we can't claim all the credit for it, but we do see that as a nice first metric that we will meet, and hopefully we'll continue to meet for at least a few years in this decade.
Just digging a bit deeper, so within those numbers that you mentioned, I'm assuming that the majority of those came from the United States. And if so, or if not, what other regions have, implemented MT?
Yeah, no, it's actually interesting. A large so US actually is not the leader, at least in the last couple of years. China has caught up in a big way and contributes a big number to it, and of course Europe. But again, in Europe, it's Western Europe that is the leader in thrombectomy, and that is really the other big driving force for MT2020, is to reduce these geographical disparities, and that number therefore would now start getting contributions with interventions from other regions that are not providing it as much. But the one thing I will point out, which is a feasibility aspect of this. So for a low-income country that has done, let's just say, for example, 20 thrombectomies in 2018, for them to get to 40 in 2020 is something that's feasible. Or, of course, if you have just zero resources, zero cath labs, then it's one thing, but at least it's in the horizon for achieving. So that's the other reason we kept it that way.
Right. And I'm really surprised that the number, your rates are meeting the intended target, because my next question was, how does COVID-19 affect this? Right? What challenges have you faced? What challenges have you overcome?
Yeah, especially, that's a good point, Ben, just to piggyback on that as well. There's also evidence suggesting that people are less likely to go to the emergency room, even though they might recognize some of the signs and symptoms of a stroke, because whether it's implicit or not, COVID seems like the priority, and people are trying to avoid those situations as much as possible. So it's just stunning to still hear that MT 2020 is looking like it's on track to still meet those goals.
Yeah, I think all of those things are true, what you mentioned, and maybe we will be slightly disappointed when the numbers actually come out. But I can tell you from my own practice and from talking to colleagues that while there was a big dip when the pandemic first broke out, we did a survey actually that's about to be sent for peer review and then hopefully publication soon, that showed that globally there was a 40% drop in stroke patients showing up at hospitals. But in Miami, I can tell you that there was a similar 30 to 40% drop at my institutions, and that recovered once the initial surge went down. There have been multiple efforts by societies, including ours, urge the public that even though it's the pandemic, a stroke will not cure itself, and they need to come to the stroke centers, call 911. And I think the other factor that is now published and well known is COVID itself contributes to a higher risk of stroke because of increasing clotting that occurs with COVID. So I think thankfully a recognition and all the systems that were built before the pandemic broke out, are a big reason why I think the rates are still pretty high, as they should be, because stroke continues to be occurring at a very high rate, and probably even just a little higher with COVID. So these numbers will be known by, I think, mid to late 21, and we can then be sure if the target was met. But ultimately, really, it is this decade that could help, that could achieve the mission for MT2020 plus. The first 10 years, or sorry, this decade, which would end up being the first 15 years. If we can get to 50% or more access globally by 2030, it would be a huge accomplishment.
Yep, absolutely. And I think, again, it's a great showing of strength from this initiative, that regardless of COVID-19, you're still able to hit the intended numbers, or even if you're a little bit less, like, it's still great that there's the capacity to do that. We wanted to give you a chance to bring up any other discussion items that you didn't have a chance to, or maybe we took the discussion a different way. So the floor is open for you.
Thank you. I greatly appreciate the opportunity. The two topics I will address are that the participation of the public, and therefore by their strength the governments, is crucial to the success of MT2020 plus. Without a recognition of the burden of stroke, and that this burden can actually be addressed now. We are no longer in the era where we are nihilistic about stroke. We are actually in a new era that you can fix a stroke and really reverse paralysis if systems are in place and the procedure and the clot busting medication is given in a timely manner. That recognition by the public would then spur their governments to make sure that this therapy is accessible, I should say, by building systems of care around thrombectomy. And so this is a major task that I would really appeal to the public, and therefore to their governments, because governments will listen to their constituents as much as we are advocates, as MD volunteers, as doctors who are volunteers. Really, the call has to be heard from the public of the importance of building thrombectomy systems. That's, we know, is not going to be easy, but that's exactly why MT2020 is there, and is going to be there for a while. And through forums like this, we hope to reach larger and larger audiences, and really start conversations, get the message out to the right people in power who can implement policies that will facilitate thrombectomy access. My parting message would be to know that stroke is now treatable, completely treatable in a number of instances if care is accessed, emergency care is accessed within 24 hours, but sooner is better. And then certainly prevention, 1 ounce of prevention is worth pounds of treatment. So that certainly is all of our individual responsibilities to follow preventative measures from the get-go every day, so that strokes can be prevented in the first place.
Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our content and would like to stay up to date, follow us on Instagram, Facebook, Twitter, and LinkedIn. To learn more about our community initiatives and how you can support us, visit our website at thepublichealthinsight.com. Join the PHI community, and let's make public health viral.